Hi, my name is Kaitlin Walden, and I am the parent and full-time caregiver for my daughter Shayla, who is a sepsis survivor. Today, I'm here to tell you a little bit about our story and our journey with sepsis. Shayla was diagnosed with sepsis at 2.5 weeks old. So our story really started immediately after I had given birth. For the first 2 weeks of her life, she was happy, healthy, doing all the newborn things. And then as we started to reach that 2-week mark, things got a little different. We went for her first appointment with her doctor. She was struggling with formula and having some symptoms such as diarrhea and projectile vomiting. So, with that, we decided to have some tests done just to rule out if there was any underlying conditions such as like food allergy or pyloric stenosis because of the vomiting. We were ruled out for those things, but things continued to decompensate essentially. By the time Shayla was 2.5 weeks old, the vomiting, diarrhea turned into lethargy. We began trying to figure out what was going on, but this happened to be about a Saturday. And so, Saturday service, as far as healthcare and her pediatrician's office, was really challenging for us. So, I started calling our nurse advice line. It was coming into flu season, and I was very concerned with me being postpartum and her being a newborn, exposing us to multiple healthcare entities over the course of a few days. So I first had called our nurse advice line on that first Saturday where Shayla was just not rousing and it was very challenging to feed her. We went through all of her symptoms. They did triage and they told us that it was okay to stay home. She didn't need to go to the hospital. At that point, Shayla was averaging about 11 to 12 dirty diapers a day, which made it very hard for me to track what her input and output looked like as far as urine went. And that became one of the sticking points for us in Shayla's story. By the next day, which was a Sunday, Shayla still just didn't seem right. I'm postpartum. She's my third child. And so I definitely knew what I was doing as far as at least I thought I did. And I work in healthcare. So that was something that I was paying really close attention to my training and what it was like with my other children. But she was sleeping through the whole night without rising to eat. And I thought that that was very strange. So the next morning, I called our nurse advice line again and I let them know what was going on, that Shayla was having severe vomiting, diarrhea, and lethargy. And she was really just not eating. And so they triaged us again and they said that a doctor would call. And so that was our first indication that something may not be right and our first interaction with a healthcare provider outside of our pediatrician's office where things were going a little downhill. So the pediatrician had called and they had asked me some questions in regard to Shayla's symptoms. And so I expressed that she was projectile vomiting still. She was very hard to rouse. She was having severe diarrhea, but she did not have a fever. And that's something that became a common link in our story. Shayla never had a fever. So she said, "Well, she doesn't have a fever. This is amazing. That's really good news." So she asked me to check her fontanelle. One of the issues with that, though, is that Shayla was born with overriding sutures. And so her fontanelle was much smaller and a lot harder for me to palpate to determine whether I felt like she was dehydrated or not. And I expressed that. And she said, based upon her symptoms, everything seemed to be stable enough for us to wait to go see her pediatrician on Monday morning when they opened up. So, as the day progressed, I got more and more uncomfortable. Shayla was looking very mottled. Her breathing was looking shallow. So, I decided we needed to go to the emergency room. And at that point, we went to an emergency room where Shayla had an in and out catheter to determine if she had a UTI or not. UTIs run in our family, specifically with her sibling who had them as an infant and a large history of those. So we did bring that up. Again, Shayla did not have a temperature at this point and continued to still have mottled skin, reduced feeding, lethargy, diarrhea, and vomiting. The in and out catheter produced a sample where they told us that she had white blood cells in her urine. And at that point, I was very familiar. I said, okay, we have a UTI in our hands. Are we going to treat? And the ER doctor said no. She said that she didn't want to start an antibiotic right away because that could lead to other complications in her experience. So she sent us home and said that we would get results by Monday and to be on the lookout for a phone call to decide. And in the interim, just to keep giving her Pedialyte instead of formula. The next morning, we went to her pediatrician's appointment, and Shayla was born at 6 pounds, 8 ounces. She was now 6 pounds, 1 ounce. And so we were having weight loss. And that became a trigger to our pediatrician that something didn't seem right. But they were still looking for those records and for the results from her urinalysis. Fast forward, we're now looking towards day 4. Shayla's still home, projectile vomiting, and she gets a rash, which now I know is sepsis rash. And so I immediately took her in. Our pediatrician wasn't available. And she said, I don't know what this is. And Shayla then at that point weighed 5 pounds, 5 ounces. So in the span of 4.5 days, Shayla was losing weight. She was not rousable. She had mottled skin. She had all of these GI symptoms, but no fever. And they kept saying to me, she has no fever. Don't worry about it. It's really hard when you're postpartum. We know that these things are scary, but don't worry about it. It's hard being a mom and a new mom and having a newborn was something that the doctors kept saying to me and trying to reassure me that my anxieties and my concerns were valid, but also being a new mom to newborn can also bring a lot of fears and anxieties as well. So that doctor said that she felt like Shayla was becoming failure to thrive, but she didn't know why. And she suggested we go home and wait to see our normal pediatrician who was out of the office that day, who came back on Wednesday. This was October 17th of 2018. So we went home. They prescribed her Zofran for the vomiting. And I went to pick up the script, and Shayla had a blowout diaper. And I said to my husband, we're going to the hospital, a different hospital, and we weren't going to leave. We went to that hospital. They did a bunch of workups. They said she had no fever, but that they were going to transfer her to the children's hospital. And everything from there just kind of spiraled. Once we got to the children's hospital, there was a feeding tube placed. There was everybody from the radiology department to the NICU and PICU trying to gain access to her veins. They couldn't. They blew every vein. We just ended up being pushed into the pediatric ICU unit. And at that point, the doctors kept saying, we don't know what's wrong. And I brought up that she had had her urinary urinalysis on that Sunday and that there was white blood cells in her urine. And they kept looking for those results, but none could be found. At that point, we were told that Shayla was critical. No one had mentioned sepsis to us at this point, but we knew that she was severely ill and nobody could figure out why. With that came with the whole sepsis workup. She had a spinal tap, she had tons of blood work, and then she was intubated and put on life support. They told us she was so critically ill that they weren't sure that she would make it through the night. She did, but she was very, very, very sick. At this point, still no fever. They were very confused. And they did a whole workup as well just to rule out meningitis. With that, they came back and said that she was in septic shock. At that point, her kidneys were shutting down. Her heart was really struggling. And they were just focused on trying to keep her alive, which was terrifying for my husband and I. They just didn't know where this infection was coming from. And so with that, they were able to find records to find out that she had urosepsis. Shayla had a gram-negative E. coli infection from her UTI that was not treated. The whole experience getting to sepsis was kind of this up and down road. We had lots of doctors who were concerned, but not concerned enough because she never showed a fever. And with that kind of made our story go a little bit longer and her trajectory of getting diagnosis longer. That was really challenging for the doctors. It was challenging for us. And once we found out that she had sepsis, they were able to start working really quickly to try and treat this. Shayla spent multiple days on a ventilator. And from there, we went into a step down unit eventually, where she had damage to her kidneys and she was not able to absorb food due to an intestinal injury. She continued to lose weight because of malabsorption and was put on elemental formula to help her survive. In that moment, still nobody really spoke to us about sepsis. I knew what was going on just because of my medical background, but had I not had that intuition, I'm not sure that I would have caught on because my spouse didn't. And they never really uttered the word sepsis to us. They never said, Shayla has sepsis, Shayla is in septic shock. They used other words such as blood infection, or we believe that her body's in a huge immune response. Um, and that made things really confusing for us because we weren't sure what this meant for her in the long term. So with that, um, Shayla experienced multitude of issues when it came to recovery. And that was the food, her cardiac health, her urinary tract health, her kidneys, and her brain. Shayla had incredibly high ammonia levels. They were 179 when she was first admitted to the hospital. We saw a metabolic doctor because they were very concerned that she had a metabolic condition, but that was ruled out. In fact, the ammonia level was so high because of sepsis and because of the infection in her body. We were met with a lot of different teams, a lot of uncertainty, but nobody really expressed to us what sepsis would mean for Shayla after the fact. It was just getting to that initial diagnosis, and then how do we keep her from passing away, to how do we sustain her recovering inside the hospital as far as feeding went and supporting her body. Elemental formula became a really good lifeline for her to help her start to regain strength and allow her body to start healing and not have to worry. But no one explained to us what that would mean long term. So when we were coming to the end of our stay, which happened to be almost a month, we were met with our discharge team and they gave us discharge papers. And that's the first time I saw the word sepsis. It said post sepsis discharge and E. coli gram negative infection and failure to thrive was also on there as well. Um, no one explained to us what sepsis would look like for her long term as far as recovery went. The only things that we were met with upon discharge were come and meet your pharmacy that's going to supply her with formula, and that we needed to follow up with neurology because of the ammonia levels, metabolic because of the ammonia levels, and gastrointestinal because of her intestines. There was no overarching discussion of what post sepsis syndrome could look like in a child and a pediatric patient, what her expectations were for growth and development as far as milestones. Would she hit milestones like every other child her age, her peers, or would we be expecting delays? So when we discharged from the hospital, we knew that we had a team, but we didn't know what was ahead for us. And that was really challenging with a newborn baby who just went through a critical illness and not knowing, where we were going. And so we began our journey, our post sepsis journey, which has turned into a 5-year journey, a journey that we're still on. Our discharge and transition was just a lot of paperwork, as I mentioned, as far as formula and who to follow up with. And once we got into a stage where Shayla was about 6 months old and feeding became a thing where we should try foods, that's when things started to stick out to us. Shayla was still having a hard time digesting food, but we weren't aware that that could be a side effect of sepsis. Shayla also started not hitting milestones as far as rolling over, sitting up, babbling, being able to hold things. And so we started visiting our pediatrician to see if we could see a developmental peds, as well as continuing following up with her other doctors, the GI, neurology, did an EEG, and then we were discharged. And then metabolic did metabolic testing, and we were discharged as well. So really, our hub was GI. What ended up kind of rolling the ball into what sepsis could have done to Shayla took a long time. And I'll say this with preface that we are a military family, and with that comes moves and a hard time having continuity of care. But through our journey with discharge and what our life looks like now, it took us some time to get there. And with that, I find that in the pediatric world, there is a constant turn of education and learning of what sepsis can look like in a child, especially a neonatal patient, and what that means for them long term. I always wanted to know what this would mean for Shayla long term, but we were never given a good roadmap because I think a lot of people just don't know. And obviously, recovery is very individualized. But I was never aware that Shayla would never, she would never know who she was pre sepsis. We would never know who she was before sepsis. I would never know that Shayla would never be able to eat food again. Shayla survives still to this day on amino acid based formulas. I never knew that sepsis would affect her speech. Shayla didn't start talking until she's 3. She's 5 now. We've had occupational therapy, speech therapy, physical therapy, feeding therapy since she was 1.5 years old. I wasn't aware that those services would be something she would need because no one told us they would be something she would need. No one told us that it was a possibility, I guess is what I'm trying to say. Those possibilities turned into our reality. Shayla struggled to walk. She struggled to speak. She had balance issues. One of her pupils was larger than the other. And so, as we transitioned from one duty station to another, I started asking the questions. What did sepsis do to her body? And what does that look like? Today, it looks like brain damage. It took us 5 years. And this fall, Shayla finally had a brain MRI. We always knew that sepsis in a baby could have complications. And we also knew that ammonia levels so high could also affect a child's brain or anybody's brain. But for many years, we asked a lot of questions specific to her balance, her mobility, and her milestones not being met. And so, with that, we had a brain MRI this fall to find out that Shayla has brain damage. And that was really challenging for us to be in our journey on year 5 to find out a diagnosis that comes from sepsis, a diagnosis that comes from her urinary tract infection, has really reshaped the way that her care looks now. For 5 years, we had care seeing many, many, many specialists that was focused more on the gastrointestinal injuries that came from sepsis or her speech and development. She was diagnosed with global developmental delays. Well, now we know that way back when she was on life support, there was this injury that occurred. And we're in the process of her being diagnosed with cerebral palsy. With that brings mobility, mobility aids, and a new trajectory for her life. There are so many things that I wasn't aware of that could happen to a pediatric and neonatal patient with sepsis. The personal experience that I had was that our doctors were incredible. They saved her life. I just think that there is an opportunity for us to continue to learn from each other from a patient perspective and a provider perspective. And with that, is trying to find what those roadmaps look like for the pediatric world. I've spent a lot of time researching and trying to figure out what would be normal, I guess, what would be expected from a pediatric patient. And often I'm met with incredible doctors who say, that's a great question. We don't fully know. And I think we're in a space where there's this precipice of information. And I hope that Shayla's story can be a part of that journey for healthcare, for finding a roadmap for parents like myself and my husband. I hope that our story can help lend information that you don't need to have a fever to have a raging infection in your body. I think that's my biggest takeaway is that I wish that our doctors had thought about a child having a severe infection that didn't involve a fever and what that would look like. I think if she had had a fever, her outcome would have been different. And I only say that in the sense that everybody in the healthcare world and the training I received, we look at fevers, especially in newborns, as being big alarm bells. But sometimes the body doesn't create that. And for Shayla, it didn't. Her whole entire life and our whole entire life has changed forever. We won't know what our lives would look like if sepsis never came into it. Shayla will never get to eat a birthday cake. Shayla will never know a life where mobility doesn't challenge her. Shayla will never know a life where her brain isn't scarred forever. Sepsis in a neonatal child, and in children and babies is life altering in some ways. It is the beginning of their story. And for our story, it's the only one that we know. I hope you take away from this conference Shayla's story and remember her name when you're looking at pediatric patients who come into your office who may show signs of sepsis, but may not be showing signs of a fever. I hope that you know that families like ours would love to continue to work and have open dialogue to find the best plan of action for our children. And I hope that you enjoy the rest of this conference. Thank you so much for having me.